So about introduction, number one, WHO, which is the World Health Organization, spoke about COVID-19 as a big health problem in worldwide. So they talk about COVID-19, which is the very dangerous virus, and it's really spreading really fast, and it's giving a lot of pressure on the hospital and the other countries too, because this virus is really dangerous, and they had no cure to heal the virus. So we had to it's explained about how to be careful and always took care of your health so that you could not get the virus COVID-19. The second one is it affected 230 countries with 1,015,162 positive cases and 22,1941 dead by April 10, 2020 COVID-19, which is in that year there's a lot of people who die because of COVID-19. So it shows that it's really spreading really fast. Even you just how should I say, like, even you touch or everything anywhere, but still you really you got from the virus. So because of that, people really had to be careful, and because of the virus also we have to be we have to stay at home, and that's why they do it for the lockdown, so that people will get into their place really safe, so that they didn't get the virus. So I think the lockdown was almost more than 1 year, but I think it's the best choice so that your loved one will get safe. So the third one, which is caused by a new virus, which is SARS-CoV-2, a new type of virus. It spread through close contact, even though you cough, sneeze, or touching things somewhere, and it will spread on your body, and it will cause because of that you will get the virus really fast. So I think the new virus is more dangerous the previous virus, which is COVID-19. So I think no matter where we are, we always had to care of ourselves. Having a lot of drink of water, that's the only solution. And I think to care of yourself and always stay safe. Thank you.
The fourth is about 80% of patients have mild infection and get better. Around 80% of people who get COVID-19 only have a mild symptom and recover without needing special treatment. Last but not least, is about 3 main places where the virus spread. First, crowded place. The virus spread more easily in place with many people. Second, close contact setting. The virus spread when people are close to each other. Third, confined and enclosed spaces. The virus spread more in closed area in little fresh air.
For the first line graph in our presentation is deaths per 100k adults by vaccination status. The first line with red color is for unvaccinated, and the second line with blue-black color is for boosted, and the third line for light blue color is for 2 doses. The first line is unvaccinated. The reading is 0.36, and it went up gradually to 0.8 and rocketed to 5.65, and this is the highest point in this line graph, and then it plummeted to 1.62. and it dropped to 0.89 and bounced back to 3.54, and then it plunged to 0.12, and this is the lowest point in this line graph, and then it recovered to 0.34, and then it decreased to 0.22. For boosted and 2 doses, the trend and movement for this line graph is fluctuated. For boosted, it from 0 increased to 0.36, and then it decreased to 0.22 and decreased and dropped to 0.11 and fell off to 0.04, but it soared up to 0.4 and then fell off back to 0.04. And for 2 doses line graph, the reading is 0 increased to 0.1, and then it's climbed up to 0. And then it fell off to 0.02. I'm sorry. And then it's climbed up to 0.13, and then it fell off back to 0.01, and it remained constant for the next month. And that is the trend and movement for the 3 line graph shown in deaths per 100k adults by vaccination status. Thank you.
This graph shows the died rate per 1,000 people in different states in Malaysia. Selangor has the highest died rate, followed by Negeri Sembilan and Johor, which also have high number. In contrast, Putrajaya has the lowest died rate. This data highlight the difference in died rates across the state, which could be due to factors like population size, access to healthcare, or other social and economic conditions affecting health in this area.
Assalamualaikum, my name is Naima binti Ghazali. My nometry is 03TKA22F1110. So I'm gonna explain about death by date of that. So in 21 March 2020, only few people who died, so it's okay, better. But when it comes to 15 July 2020, it became a little higher, so it became more people who died because of COVID. So when it comes to 8 November 2020, it became lower, so I think it's better. But in 4 March of 2021, it became higher, so I think it became higher, so it's dangerous, and because of that, lots of people died. But in 28 June 2021, it became very high. It's actually the highest death people on 28 June 2021. So for me, it's really dangerous COVID, and it's really cause of people that will be die. On 2020 October 2021, it became only little. It became more lower, but it's still this, for me, it's second highest for people dead. And when it comes to 15 February 2022, it became more lower. I think it's actually better than before, so I think it's better people who died on 15 February 2022. But when it comes to 11 June 2022, I think it's the better, and it's because it's already low, so only few people who died on that date. But in 5 October in 2022, no more people who died because of COVID-19.
Okay, so to conclude our presentation for the topic COVID-19 deaths in Malaysia, in addition to vaccination, there are other ways to stop the spread of the virus that can cause COVID-19. If you feel ill or have COVID-19, stay home and away from others, including pets if possible. Avoid sharing household items such as dishes and towels, if you are sick. In general, make it a habit to test for COVID-19. If you have symptoms of COVID-19, test for the infection or test 5 days after you came in contact with the virus. The second one is help from afar. Avoid close contact with anyone who is sick or has symptoms. Like what we stated in the introduction, there is preventing 3C: crowded places, confined places, and close contact settings. The third one is wash your hands. Wash your hands well and often for at least 20 seconds, or use an alcohol-based hand sanitizer with at least 60% alcohol. The fourth one is cover your cough and sneeze. Cough or sneeze into a tissue or your elbow, then wash your hand. This is for us to reduce the spreading of the virus COVID-19 by using the wind and airflow from spreading quickly and speedily. The last one is clean and disinfect high-touch surfaces. For example, clean doorknobs, light switches, electronics, and counters regularly. Try to spread out in crowded public areas, especially in places with poor airflow. This is important for us to wear masks whenever we go indoors or outdoors, for us to preventing all the risk of the COVID-19 cases from arising. Okay, that's all from us. Thank you.